Hi, this is Joseph Pate with Lakefront Insurance Group, more commonly known as Medicare Joe. And today we're going to break down the difference between Medicare Supplement Plan G and Medicare Supplement Plan N, so stick around. Welcome back. Like I said, today we're going to be explaining Medicare Supplement Plan G versus Medicare Supplement Plan N and how those two plans break down. If you have any questions throughout the video, feel free to pause it and give us a call. My number is listed here below, and don't forget to hit the red subscribe button in the bottom right hand corner. So let's take a deeper dive into the Medicare supplement policies that one can enroll in. A quick note to remember is that all of the Medicare supplement policies are standardized, meaning that you can get the same exact plan regardless of who the carrier is. They're standardized based on the letter. So a Plan G is a Plan G, a Plan N is a Plan N. The benefits are identical based off of the plan letter that you have. So let's take a deeper dive into Plan G and Plan N, and let's get a side-by-side comparison here. As you can see, I've listed Plan G and Plan N next to each other, and if you look down the columns comparing the two plans, they're almost identical. I've highlighted the two differences that we can see here between the two plans. On Plan G, as you can see, the Medicare Part B coinsurance or copayment is covered at 100%, and on Plan N, there's a few asterisks there. So what do these asterisks mean? Well, both Part B coinsurance and the copayments are covered at 100% on Plan G and Plan N. The difference in why there's asterisks here on the Plan N is that when you go to the doctor, they can charge you up to a $20 copayment, and when you go to the emergency room, they can charge you up to a $50 copayment. All other coinsurances and costs are covered at 100% except for those two copayments. So that's why that's listed there. So let's take a look at what that means and how that works between the two plans. And before we get into that, the other difference is the Part B excess charges. We're going to come back to that in just a second here. So let's take a deep dive into the Part B deductible and copayment and see how that works with the side-by-side view. So the deductible is what the insured pays before the insurance company will cover services. This is always billed to the insured after the visit, normally a week or 2 weeks after the visit. A copay is what the insured actually pays at the time of the doctor visit. With Plan G, once you meet your Part B deductible, there are no copays to pay. You pay your deductible, which as of 2020 this year, it's $198. Once you meet that deductible, that is it. You don't pay anything after that. On Plan N, the difference is once you meet your Part B deductible, like we were talking about a minute ago, doctors can charge you up to a $20 copay for some office visits and a $50 copay for emergency room visits. So how does this all break down? Well, I brought the plans here so you can see again. We have Plan G, 100%, Plan N with those asterisks. So let's see how those asterisks actually break down on a numbers standpoint. Again, Plan G, once you meet your Part B deductible, there's no copays. On Plan N, once you meet your deductible, they can charge you a $20 copay. So let's use an example of someone who goes to the doctor 5 times per year. I'm going to use this example just to look at doctor visits because folks that go to the emergency room is so less frequent. It really doesn't play a part in the plan comparison and how these numbers break down. So keep that in mind. We're going to look at just the doctor visits and how that would work. So for this example, again, we have someone who will go to the doctor 5 times per year. So as you can see on Plan G, for doctor visit 1 and 2, normally 2 doctor visits it's going to take you to meet that deductible. If at the beginning of the year you're seeing a high-end specialist, you may meet that deductible with just 1 visit. For this example, let's say it takes you 2 visits to meet the deductible. As of 2020, again, that's $198 this year. Once you meet that doctor deductible on Plan G for visit 3, 4, and 5 throughout the year, you won't pay anything. It's all covered at 100%. Alternatively, on Plan N, you have doctor visit 1 and 2, again, would also go towards your deductible. But then doctor visit 3, 4, and 5, let's say worst case scenario, they all charge you a $20 copay, which that's the most that they can charge. You'd have $60 worth of copays for those visits. 3 visits times a $20 copay. That's how we're getting that $60 number there. Again, $20 is the most the doctor can charge you. So this is a worst case scenario. Some doctors don't even charge the copay. Some doctors charge less. This is worst case scenario. So how is the Plan N a cost-effective plan? Well, for someone who doesn't frequent the doctor a lot, it actually is very cost-effective when you compare the premiums. So on Plan G, I've brought up an example here of a 68-year-old male from Pennsylvania, non-tobacco user, just to throw some quotes into the mix here. And on Plan G, the best rate was with Aetna, $125.95. And on Plan N, also Aetna had the best price currently at $94.71. So the difference in the premium here is $31.24 per month. If we take that and we annualize it times 12 months, that gives us a total yearly difference of $374 for the year. That's how much more Plan G is costing than Plan N. If we keep in mind that the major difference between Plan G and Plan N is the $20 doctor copay. Again, that's the worst case scenario. They charge you a $20 copay when you go to the doctor. That gives us a break-even point of taking that annual savings divided by what would be a $20 copay for the visit, 18.7 doctor visits. This is your break-even point, rounded up to 19. If the insured would go to the doctor 19 times and be charged a $20 visit for each visit, Plan G would be a better option than Plan N. However, if the insured goes any less than 19 times during the year, they would be saving money on their plan. So for folks that frequent the doctor once, twice, 4 or 5 times, up to 15 times, 19 times in this example, again, it would be a cost-effective option to go with Plan N because you'd be saving money in the long term over the course of that year. So let's look at what happens after year 1 and why is Plan N becoming so popular for folks. The reason Plan N is becoming so popular is because of the rate increases and how stable they are compared to the other plans. As you can see here, I've brought over the premiums from earlier and I've attached a 10% rate increase on Plan G, which is fairly conservative, and a 5% rate increase on Plan N. Now this is a 10-year forecast, as you can see. The premiums and what would be expected if you were to take those rate increases and just constantly keep compounding them year after year without making any type of changes. Let's say, for example, your health didn't allow you to change and you're stuck on that plan. Well, let's take a look at just a 5-year window and see how that difference in premium actually can break down. Before we were talking, that difference, remember, was about $375 for the year. And it came out to a break-even point of 19 doctor visits. Well, let's see how that goes as we get into year 2, year 3, year 4, and in this example, year 5. Plan G would cost you $202.84. In year 5 on Plan N, the cost would be $120.88. That gives us a total monthly difference of just under $82. And again, if we annualize that over a 12-month window, that's $983 a year difference in premium. Divided by the $20 copay gives us a break-even point of 49 doctor visits. Assuming that every doctor that you went to, again, charged the highest that they can, which is the full $20 copay. Again, not all doctors do, but let's say worst case scenario, they do in this example, gives us a break-even point of 49 doctor visits. You'd physically have to go to the doctor and be charged that full copay almost every single week in this example to break even to where you would have been with Plan G 5 years down the road comparing these two plans. So why does that Plan G increase at such a higher rate? Well, there are a few reasons why. One of them is what's called a guarantee issue situation. So after January 1st, 2020, people that were new to Medicare can no longer buy the Plan F. The Plan F used to be the guarantee issue plan that folks would go to prior to January 1st, 2020. After January 1st, 2020, if you are new to Medicare or newly eligible for Medicare after that date, the guarantee issue plan is now Plan G. So a guarantee issue plan is where the insurer doesn't get to underwrite you. There's no health questions that you have to answer. You can be automatically approved for the plan. And that's in a few situations this occurs. Number one, if you are 65 and you decide to stay on your employer coverage or retirement plan and you don't decide to go on to a Medicare supplement plan right away. When you're ready to leave your employer plan, as long as you've had credible coverage, you can move over to a Medicare supplement plan without having to answer any health questions. Also, if you're going from, or if your Medicare Select plan, if they leave the service area, that gives you a guarantee issue situation to buy a plan without answering any health questions, as well as if your Medicare supplement insurance company goes bankrupt. In these situations, you will always get to enroll into the Plan G without answering any medical questions. So because there are no medical underwriting required in these situations, there's always a group of people now on the Plan G that become almost an unknown to the insurance carrier. There's no way to tell their claim history. There's no way to estimate the cost of this group of people because they're just automatically getting approved for a Medicare supplement plan. So the insurance carrier isn't able to correctly estimate what the cost of that group is going to be. So this is one example why the Plan G increases at such a higher rate. When comparing Plan G and Plan N increases at a lower rate because it's a healthier group of people. And someone who is ill or goes to the doctor frequently is not going to pick the Plan N because if they were to take all of their copays in that calendar year, if they're going to the doctor a lot, they're going to be back to what it would cost them on a Plan G anyway. So a lot of those folks would just pick the Plan G from the start. So the Plan N, it's a healthier pool of people. The risk selection in that group is much healthier because they're not using their plan as much. The healthier the risk pool, the lower the amount of claims that get filed within that plan, create for more stable rate increases. If you just compare the amount of claims that are coming in to the premiums being received, if that balances out or is close to balancing out, that's where you'll find more stable rate increases in the Plan N because it's a healthier pool. Now, another alternative to why Plan N increases, or rather why Plan G increases at a higher rate, is that people that are on the Plan G are more apt to abuse their coverage. Now, I'm not saying everybody is abusing their plan, but with Plan G, you'll find that people that are on the plan, policyholders, are actually going to the doctor and visiting the doctor more frequently than they maybe need to. So, and the reason why, to give you an example, let's say that somebody was maybe coming down with a cold, and if their deductible was already satisfied with the Plan G, they would not pay anything at the doctor for that next visit. Whereas on the Plan N, there would be a $20 copayment, so somebody may be more apt to say, well, I don't need to actually go to the doctor. Let me give it a couple of days and see if I get over it. So with Plan G, you'll find that there's more claims that are filed on that plan. And the more claims that are filed for the group of folks, for the risk pool, then the higher the rate increases become on the Plan G. And that's why you see that difference in what I had put in that graph was 10% and 5%. That's what the industry standards are today. Given that the Plan G has just newly become a guarantee issue pool for the folks turning 65 after January 1, those rate increases are probably going to start to go up a little bit higher than they are right now anyway. So let's come back and look at the one other difference between Plan G and Plan N, and that is the Part B excess charges. As you can see on Plan G, it's covered at 100%, and on Plan N, it's not covered at all. So what are Part B excess charges? Well, let's take a deeper dive into that. So Part B excess charges is, for example, if a doctor does not accept the Medicare assignment, or whatever the Medicare approved amount is, they may charge you up to 15% more than what that Medicare approved amount is. Now, there are certain states that do not allow for excess charges. They're considered the mom states. This is the Medicare overcharge measure. So states that are If you are insured in Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, or Vermont, excess charges do not apply to you. Doctors can't actually charge you excess charges in that state. As a matter of fact, doctors that do accept Medicare assignment have agreed to pay whatever Medicare has approved. And the most recent statistic, again, this is 2020, was that more than 97% of doctors actually do accept Medicare assignment, which means they do not charge excess charges. A lot of times where you may come across Part B excess charges is for a high-end specialist. But again, 97%, or greater than 97% of doctors in the whole U.S., because again, you can use Medicare nationwide, do accept Medicare approved amounts. So this results in a minimal role in Plan N. 97% of the doctors that you would see, if not all, are not going to be charging you an excess charge. So I always like to tell my clients, don't worry about the fact that Part B excess charges are not covered on Plan N. Number one, it's very minimal. Number two, it's probably never going to apply to you because so few doctors actually charge it. And if you're in one of the Medicare overcharge measure states, one of the mom states, it doesn't apply to you at all. This brings us to our conclusion of which plan is actually better. Well, there's a few things to consider. Number one is how frequently do you go to the doctor? Because this may not be the plan for you. If you're going to the doctor once a week, then there's going to be a better plan for you, and that's probably going to be Plan G for the Medicare supplement side. When I always ask my clients, I always ask, what's more important to you? Would you rather have lower monthly premiums, or would you rather have the convenience of not paying any copays? Because that's really the difference between the two. On one end, you have a lower cost per month, and you're paying as you use the plan. On Plan G, you are paying that up front just to have that convenience, not to have to pay the doctor when you go to see them. You're basically paying it in your premium each month. Another thing that I always like to ask them is, what's more important to you thinking forward and forecasting a few years from now? Would you rather have more stable rate increases? Or again, would you rather have the convenience of not paying copays? Because that's the only difference theoretically between these two plans, is that on the Plan G, you're paying your deductible and that's it. So you're paying upfront more or less for a convenience to not have to pay that doctor any copayments. So those are the two important questions to consider and help decide on whether you think the Plan N is actually the right plan for you. Thank you for watching. I hope this video has helped you or gave you more information than you had before. If you are looking for more information or need exact quoting, please feel free to give us a call. That's the easiest way for us to actually go over the options and plans in your area. Or you can send us an email at info@lakefrontig.com. Don't forget to hit the red subscribe button in the bottom right-hand corner to stay up to date on different things and updates within Medicare as we post videos about them. Signing off, this is Joseph Pate, better known as Medicare Joe. Take care and have a wonderful day.